Hi everyone, my name is Rileigh Ricken and I'm a current second-year medical student at Oklahoma State University Center for Health Sciences. I have had the opportunity to work alongside Dr. Emily Madrack and Dr. Jennifer Volberding looking at the impact of the first year of medical school on anthropometric measurements. After finding that my own health had declined over the course of the first year, I wanted to design a study to analyze how others may be impacted as well. First-year medical students are placed under a significant amount of stress upon starting their education. Stress is essentially a threat to the body's homeostatic state, and the autonomic nervous system properly responds to acute stress. Both acute and chronic stress exist, where acute stress is a short-term and adaptive state, whereas chronic is more of a maladaptive state with harmful effects on the body mechanism. To respond to threats and challenges, individuals are equipped with stress systems that communicate the need to adapt or survive. Chronic stress can lead to increases in blood pressure, BMI, resting heart rate, respiration rate, and pulse ox. For first-year medical students, exams, a new life situation, and personal problems are all stressful experiences that can negatively impact their health. So the overall purpose of the study was to track first-year medical students' BMI, BP, heart rate, respiration rate, and pulse ox over the first semester. At the beginning of the semester, there was data collected and participants were asked to complete an online survey for demographic information, and then their BP, heart rate, pulse ox, respiratory rate, height and weight were also collected. This was repeated at the end of the semester, and participants returned to have all of their measurements retaken. This data was then uploaded into the SPSS for analysis. Means, standard deviations, and frequencies were calculated for variables. Paired samples, t-tests, were conducted to determine differences over the course of the semester, and these t-tests were also used to determine differences in variables at each individual data collection point, as well as Mann-Whitney analysis. We had a total of 28 students participate, 16 male and 12 females. BMI and weight increased over the course of the semester for all participants. T-tests analyzing differences in variables at the initial data collection demonstrated differences in sex assigned at birth and systolic blood pressure, gender identity and systolic blood pressure, and children in the house and BMI. What this demonstrated was that males had higher levels of systolic blood pressure, while those individuals who had children living in the home had a higher BMI. Additionally, within the first data collection, a statistical difference was determined by a Mann-Whitney between being affiliated with a native tribe and diastolic blood pressure, with non-natives having higher diastolic blood pressures. T-tests for the second data collection demonstrated differences between children in the house and BMI and children in the house and systolic blood pressure, demonstrating those with children had higher values. Attending medical school may have negative impacts on students. Specifically, long-term exposure to psychosocial stress may lead to adverse long-term health outcomes. Overall, this study demonstrated that the overall rigor and lifestyle of a medical student, along with outside factors, can negatively impact one's health in terms of weight, BMI, blood pressure. Studies have shown that in addition to chronic stress, medical students have suboptimal physical activity. It was found that in prior studies that physical, emotional, and overall health are highest at baseline and reach their lowest point at the end of year one. Schools are encouraged to offer resources such as on-site gym, fitness classes, counseling, nutrition classes, mental health resources, and support for habits outside medical school to assist in mitigating the stress associated with the challenges of medical school. Ultimately, this project was a success, and I was happy to see that I wasn't the only one, but it definitely shined a light on the fact that we need to be putting medical students, specifically first-year medical students, physical and emotional health as a top priority when they begin this new adventure in their life. I hope you enjoyed this presentation, and thank you very much.